Now we are starting with Fmge one-liners, PYQs, right? So what do you see here? Yes, yeah, this looks like sauce and cheese, right? Or pizza pie. So this is your sauce and cheese retinopathy, pizza pie retinopathy, which is seen in which condition? Cytomegalovirus retinitis. Usually in HIV patients, we see this sauce or cytomegalovirus retinitis, which gives sauce and cheese or pizza pie retinopathy. Very important. All right. Moving on to the next. Okay. Now, can you spot these yellow white nodules, right? So these are called as Dallen-Fuchs nodules. What is it? Dallen-Fuchs nodules. And these nodules are seen in which condition? That's another question. Sympathetic ophthalmia. What is sympathetic ophthalmia? What is the other name of sympathetic ophthalmia, guys? Okay, so this is bilateral. It's also called as bilateral granulomatous panuveitis. Usually, you're a condition, okay? This long disease, it happens, I meant the long term, right? So, this disease happens after penetrating injury to one eye. ഒരു ഐയിൽ ഒരു പെനട്രേറ്റീവ് ഇഞ്ചുറി ഉണ്ടായാൽ the patient can have sympathetic ophthalmitis. So ആ one eye മാത്രമായിരിക്കത്തില്ല. This disease condition can progress to the normal eye also, and this condition is called as bilateral granulomatous panuveitis or sympathetic ophthalmia. Also, another question they ask you here is ഈ nodules ഏത് ലെയേഴ്സിൻ്റെ ഇടയ്ക്കാണ് കാണുന്നത്? These nodules are seen between retinal pigment these are seen between retinal pigment epithelium and Bruch's membrane, right? Fine. Okay, now tell me what this is. What does it look like? Okay, it looks like splashed tomato. Our splashed tomato appearance, where do you see it, guys? One second. Yeah, where do you see it? In CRVO, central retinal vein occlusion. Very important. Splashed tomato appearance we see in CRVO. Okay, so what you see here, this is a case of orbital cellulitis. The question that had come before was, what is the most common cause of unilateral proptosis? Unilateral proptosis in children. So the answer is yes, orbital cellulitis. What is the definition of proptosis? What do you mean by proptosis? It is a forward protrusion, or it is the bulging of the eyeball, right, out of the orbit. That is called as proptosis. Now tell me a few conditions which can cause proptosis in adults. Okay, if the question is in adults, what is the most common cause of proptosis? What is going to be your answer? Very good. That is Graves' disease. Good, Graves' disease. Fine. Now another question to you, how do you measure proptosis? By which instrument? Okay guys, so this is a picture. It can come as image based question. This is a picture of exophthalmometer or Hertel exophthalmometer. Now this is the instrument that we use for the measurement of proptosis. Clear? Yes? Now, next question. Once they had asked in one of your papers, they had asked most common intraorbital tumor in adults. Your answer is going to be what, guys? Tell me. It is cavernous hemangioma. Okay, so this is cavernous hemangioma. Now, what is cavernous hemangioma? See, it is a benign vascular tumor, or I can say it is a vascular malformation of the orbit. അപ്പോൾ ഇത് പ്രസൻറ്റ് ചെയ്യുന്ന എങ്ങനെയായിരിക്കും? പേഷ്യൻറ്റ് സേസ് പ്രോഗ്രസീവ് പെയിൻലെസ് പ്രോപ്റ്റോസിസ്. യൂഷ്വലി യൂണിലാറ്ററൽ ആയിരിക്കും. ഇനീഷ്യലി വിഷൻ നോർമൽ ആയിരിക്കും, റൈറ്റ്? അപ്പോൾ ഇവിടെ ട്രീറ്റ്മെൻറ്റ് എന്ന് പറഞ്ഞാൽ സ്മോൾ ആണെങ്കിൽ, എസിംപ്റ്റമാറ്റിക് ആണെങ്കിൽ ജസ്റ്റ് ഒബ്സർവേഷൻ, and if it causes significant proptosis, visual problems, then surgical excision. So the question they ask you is most common benign orbital tumor in adults, that is cavernous hemangioma, right? That's it. Okay, now tell me, what does this picture show you? Which disease condition, guys? Yes, this is a case of STI. What is the other name of STI? External hordeolum, right? External hordeolum. Now, what is external hordeolum? It is the acute infection of the gland C's. It is the acute infection of the gland C's. That's all you should know. Now look at this picture. What does this show you? Yes, this is a case of internal hordeolum. right? Internal hordeolum. Now, this is an acute infection of which gland? Tell me, internal hordeolum, it is an acute infection of the meibomian gland. Meibomian gland. Okay, next, last one, which is very, very important. They ask this chalazion every time. Yes, this is a case of chalazion, right? Now, chalazion, what is chalazion? It is a chronic infection of which gland? Chronic inflammation of which gland? Meibomian gland, right? So questions average it's very simple. See, optal you guys should score full if possible, right? So they ask you what is, they'll give you a clinical picture, okay, and you will know that it is stye. They'll ask you which gland is affected, that is Z's gland. Next question, most common question is chalazion. They ask you what it is. It is a chronic inflammation of which gland? Meibomian glands. Acute infection of the meibomian gland, it is called as internal hordeolum. That's all you should know, right? Now people get confused with internal hordeolum, external hordeolum. See, look here guys, stye has got E at the end. So from that you will remember E for external hordeolum, right? And from this again, from the same word, you will remember that it is the acute infection of S and Z. So stye, it is the acute infection of Z's gland. Alright, fine. Now tell me about this picture. What is this? This is cataract. Okay, now what is this kind of appearance that you're seeing? Yes, this is a case of a rosette cataract, like flowers, right? So rosette and arthan, just like the petals of rose. That is the meaning. So this is rosette cataract. And where do you see rosette cataract? It is cataract due to blunt trauma to the eye. It is due to blunt trauma to the eye. The cataract that develops due to the blunt trauma to the eye, it is called as rosette cataract. Very important image based question.